difference between clinical psychology and counseling psychology. Look at this picture. Clinical in hospital setting, counseling psychology. Look at this picture. A detail going on. Clinical psychology is the branch of psychology that focus on diagnosis, treating and preventing mental illness and psychological disorders. Counseling psychology. It is the branch of psychology that helps individuals cope with everyday life challenges, improve well-being and achieve personal growth and adjustment. Difference between one main focus. Clinical psychology focus on diagnosis and treating mental illness and psychological disorders. But counseling psychology focus on helping individuals with everyday life problems, emotional difficulties and personal growth. To client population, clinical psychologists usually work with people who have severe mental health problems such as depression, schizophrenia, or bipolar disorder. Counseling psychologists generally work with people dealing with normal life, stresses, relationship issues, or mild emotional difficulties. Three, training orientation. Clinical psychology training is based on the medical and psychological model, emphasizing mental illness and its treatment. Counseling psychology training follows a developmental and educational model, focusing on personal and social adjustment. 4. Approach to therapy. Clinical psychologists use structured, diagnosing based and evidence based treatments, but counseling psychologists use a more holistic and client centered approach focusing on growth and coping strategies. By assessment focus, clinical psychologists conduct diagnostic and neuropsychological testing to identify mental disorders. Counseling psychologists use assessments related to personality, career choice, and life adjustment. 6. Work setting. Clinical psychologists often work in hospitals, psychiatric unit, mental health clinics, and rehabilitation centers. But counseling psychologists commonly work in schools, colleges, community centers, and private counseling practices. 7. Severity of issues. Clinical psychology deals with serious and abnormal behaviors and mental disorders. Counseling psychology deals with normal developmental and adjustment issues. 8. Research orientation. Clinical psychology research focus on mental disorders, diagnosis and treatment techniques. Counseling psychology research focus on lifespan development, counseling, techniques, and multicultural aspects. Now, in educational emphasizes clinical psychology programs emphasize clinical internship in hospital medical setting. Counseling psychology programs emphasize practical experience in counseling and educational environments. 10. Therapeutic techniques. Clinical psychologists often use techniques such as cognitive behavioral therapy, dialectical behavioral therapy, or psychodynamic therapy. Counseling psychologists use humanistic, person centered, and solution focused techniques. 11. Goal of therapy. The main goal of clinical psychology is to reduce symptoms and manage mental illness. The goal of counseling psychology is to promote personal growth, adjustment, and overall well being. Thank you. Have a nice day.